Mary, thank you so much for joining me today. I want to ask you about how confident you feel in whether the pharmaceutical industry is heading in the right direction in terms of its focus on the patient and beyond.
I am confident that the pharmaceutical industry is going to take great strides forwards together with the patient groups. I think we've had a very good time working together, establishing transparency, which Richard Bergstrom has certainly worked awfully hard on at FPIA. But I think the transparency now must lead to trust. And we need one another as we've never needed one another before, because I think with the challenge of an ageing population, the comorbidities, the polypharmacy, and the total costs of the health systems, there are already murmurings that it's unsustainable. Now, if something's unsustainable, it means all hands on deck. We have to work together, and I think we will work together and move from this transparency to trust.
What are the barriers that pharmaceutical companies have, whether internal or external, getting to that situation?
I think internally there are barriers within the big pharmaceutical companies because you have so many professions in your workforce, and sometimes they're very siloed. It's not uncommon for me to say to one member of a team of a big company, "Do you know so-and-so who's working in government affairs?" And they don't. So they're siloed, and I think they've got to work very hard to try to undo that, if possible, within. Externally, I think they've always got the challenge of the media. I mean, when you talk to the media, they will say very, very frankly that to sell a newspaper, bad news sells much faster than good scientific progress. So I think, and together, that's something we could undertake.
The pharmaceutical companies still have a poor reputation amongst the wider public, and you've just talked about the media as being an influence. Is there anything that you can suggest at all that the pharmaceutical companies could do and should do better to somehow turn that around?
I think the pharmaceutical companies are very vulnerable with the media. As I say, they like a bad story. But I think there's a wonderful opportunity, and the one I see most is the big data scenario. I mean, it will be so beneficial if the pharmaceutical companies can have back the real-world data of what the medication is impacting society's lives. Now, they've got to gather that. And that's, of course, where they're going to use the IT systems. And I think the biggest challenge to the pharma companies is how they're going to collect the data and the challenge of privacy. Because if one company blows this, the media will have a wonderful feast day. So I think that's something where we've really got to work together and ensure on both sides that it's an essential part of hearing about the consumption of medication and what it's doing to people's lives, the patient-reported outcomes, I think really important. And I think society understands that and wants to play their role in this.